This is the Royal Manchester Children's Hospital, where staff treat around 400 children every day. Coming up, 8-year-old Caden faces his 38th operation.
He has always got a smile on his face, but it gets harder.
In A&E, things for Professor Simon Carley get a little too close to home.
It'll make it feel better.
And after 6 long months, 15-year-old Sean Malone prepares to leave the hospital in his own special way.
I'm walking out with my head high.
We're about to meet an 8-year-old boy who's no stranger to the Children's Hospital. He's had an astonishing number of operations, but somehow this brave boy manages to keep on smiling. 8-year-old Caden was born with spina bifida, which means his spine didn't form properly when he was growing in the womb. He's already endured 37 operations.
He was a day old and he was took straight to the Children's Hospital. He had his first surgery at 2 days old, and then it's just been an ongoing thing really, in-out operations. Affects his mobility, never be able to walk, so he's basically paralysed like from the chest down.
My legs don't work, but my brain does.
Like many of the hospital's regular patients, Caden's very popular with the staff. Nurse specialist Carmel Gagan has known him since he was born.
Because he comes in so frequently, you get a very special relationship, more so with Caden because he's so cute and so special. Everybody remembers Caden. The hospital is like a second home and we're his second family.
Caden certainly makes the most of life on the ward when he's here and has formed a very special bond with one of his fellow patients.
Summer's Caden's friend, both met in here, they've both got spina bifida. And they fancy each other really.
I did you say that?
He might look cheery now, but Caden's been admitted to hospital because he's recently been suffering from severe headaches and sickness.
It got to a point when Caden said, I need to go to the hospital, and when Caden says that, that's when we need to go.
Like many other children with spina bifida, Caden also has hydrocephalus, known as water on the brain. It's a condition Daniel Hallsgrove has encountered many times in his 4 years as a surgeon.
We can get a build-up of fluid within the fluid cavities of the brain, and if that's untreated, it can put pressure on the brain, which can be harmful.
To counter this, when Caden was just 3 months old, doctors inserted a device called a shunt just under his skull, which drains the water from his brain.
This is a scan of Caden's brain, which shows the fluid cavities within the brain. So normally we all make this fluid and then the cells within the brain reabsorb it. With Caden having hydrocephalus, that can cause a build-up of that fluid, and therefore we have to find an artificial way to divert that fluid away. And we do that with the shunt, which is a piece of tubing which passes from the fluid cavity underneath the skin, and then you can see that tubing coming down here, past the chest, and then down into the tummy, and that's where the fluid gets reabsorbed down there instead of in the brain.
Doctors suspect Caden's having headaches because his shunt isn't working properly. They want to get him into theatre as quickly as possible to investigate under anaesthetic.
It could be that the shunt's not draining enough fluid and that's causing the pressure to rise inside his head. But what we're planning to do today is to insert a pressure monitor that will tell us how well the shunt's working and what the pressure is inside Caden's brain.
The operation to fit Caden's monitor will take just half an hour, but it will be an anxious wait for Mum Lindsay.
I'm hoping that it is his shunt, because then we've got an answer for the headaches and they can correct it and hopefully have Caden back to normal.
The results will be back in 48 hours. Only then will doctors know if Caden's shunt is the cause of his headaches or if it's something more serious. Staff in the hospital's A&E department are prepared for any eventuality and are used to staying calm in a crisis. But sometimes things get a little too close to home, even for Professor Simon Carley, who's worked in emergency medicine for 18 years.
This is Emma. She's had a little fall this morning and she fell off a desk, and we think she landed on her arm, and she's got a little fracture to her elbow. They're quite common in children, but fortunately it's one that we can just treat with a plaster rather than with an operation. So we're all very pleased about that.
It's a relief because Emma's no ordinary patient.
Emma is my youngest daughter, and I was in charge this morning. Where's Mummy? In London. And what does that mean? Who's in trouble if Mummy's in London and something like this happens?
Professor Carley is now officially in the doghouse. And to make matters worse, this was supposed to be Emma's special day.
It's also Emma's birthday today. So this is a really quite spectacular number of events happening at the same time. But Emma's been very brave. She's been very good, haven't you? And we're going to put a plaster on now and make it all feel better.
Putting the plaster on today is Professor Carley's colleague, modern matron Rachel Whittington.
This isn't going to hurt when I do it, all right? And if it does, you tell me or your daddy and we'll stop, OK? It's like doing your washing. Are you ready?
This is nice, this bit.
And this bit just bends up here like that and protects your elbow.
Just for a second, Emma.
Good girl.
If you're the parent of a child and you're also a doctor, you're always conflicted between the two roles. So you're kind of half trying to be involved in the treatment and half trying to be the dad. And what you should really do is just be the dad. But that's really hard. And make it feel better.
It's tough for them both. But having a doctor as a dad does have its perks.
I think somebody knew it was your birthday.
Yes, it's your birthday today.
That's a good girl. Well done.
That's fantastic. That looks really good. Perfect.
Well done, sweetie.
I am 6 lots of love from all the doctors and the nurses in the emergency department. How fantastic is that?
Emma's arm will take at least 6 weeks to heal, so right now the only medicine she really needs is a cuddle from Dad. Caden Gresty was born with spina bifida and water on the brain. He's just 8 years old, but has already had 38 operations.
It gets harder letting him go because he knows what's happening. But Caden's one of them children where, you know, he has always got a smile on his face and he never really lets it get him down. So I think that makes it better that Caden's still smiling.
Caden's recently been suffering from severe headaches, and doctors suspect a shunt, which should be draining fluid from his brain, isn't working properly.
You know what I'm going to do, don't you? Take the little stitches out and then just pull the little wire out.
2 days ago, he was fitted with a monitor to measure the pressure in his brain.
All right? Might just have to pull it a little bit. Done. That was in your head. Can you see the end?
The results of the monitor will identify if there's a fault with Caden's shunt. If there is, he'll have to have another operation.
It is scary now. I don't want him to have any more surgery, but if he's got it, there's nothing he can do. Just wish I could take it away, but obviously I can't.
Specialist registrar Chris Parks, a neurosurgeon for 5 years, has the results.
The tracing of the pressure inside his head shows that there's a problem with his current shunt that he's got in place. That's probably the cause for his headaches, and the pressure is going up to sort of twice what it should be, really.
Mr. Parks won't know which part of the shunt is faulty until he examines it in theatre. It's an operation that nobody wants to put Caden through, but if left untreated, the build-up of pressure in his brain could lead to serious damage.
Just prepare now for tomorrow. Hopefully I get rid of the headaches and hopefully by next week go home.
It's the following day and Caden's on his way to theatre for his 39th operation. It's a familiar process, but it never gets any easier.
I have had enough now, and I think Caden's had enough. I just want him better now, and I want to be home.
In theatre, Mr Parks is getting ready for Caden's operation.
Hopefully, if we get things working properly, then it'll mean that he won't suffer with the headaches that have been bothering him, which will mean that he'll be able to get out of hospital and get on with his life, really.
He still doesn't know which part of the shunt is faulty, but if he has to change the whole device, it will mean operating on Caden's head and stomach, which is a much bigger procedure.
So what we'll do is test the 3 parts of the shunt and see which ones are not working. It can be that the whole system needs replacing.
The sooner he locates the fault, the less invasive the surgery, and the closer he'll be to removing the cause of Caden's headaches. 8-year-old Caden Gresty's just gone into theatre. Caden's lived with a shunt system in his brain since he was 3 months old, which drains excess fluid into his stomach. Surgeon Chris Parks has discovered that his recent headaches are being caused by a fault in the shunt. He's now trying to find out which bit of it isn't working. The sooner he finds the fault, the better. If he has to change the whole device, it will involve operating on Caden's head and stomach.
Can we get a syringe and the manometer, please? Perfect.
Mr Parks begins by checking the pressure in the section closest to Caden's brain. This is a relatively straightforward procedure, but it's precise and delicate work.
That's clearly not working as well as it should do.
And just 10 minutes into the operation, Mr Parks thinks he might have found the problem.
It's connected to the cranial end, the part that goes into the head, and there's no rush of fluid back, which to me implies that that's probably blocked. And will need replacing. Pass that back to you.
He's found a blockage in the shunt. He now needs to go about fixing it.
So we've inserted a new ventricular catheter, which is a tube that goes into the fluid spaces in his head. We've connected that to a new valve, which was blocked, then connected to the old tube that went down to his tummy, which was working absolutely fine. It should stand a very good chance of helping his headaches.
It's great news. After checking the rest of the shunt is working properly, Mr Parks completes Caden's surgery without operating on his stomach. It's a huge relief for Mum Lindsay.
Good news.
Caden will be monitored on the ward for the next 48 hours, but will only be allowed to go home if his headaches stay away. Sean Malone was a healthy 15-year-old until a rare complication from the normally straightforward condition, sinusitis, left him on the hospital's intensive care unit fighting for his life. All his family could do was hope and pray. After 5 agonising weeks, Sean started to come round, but the infection had a devastating effect on the right side of his brain, which meant he couldn't move the left side of his body. But the part of his brain that controls language, memory and emotions remained virtually intact, and Sean's a fighter.
Really good.
With help from the hospital's neurology team and a massive dose of determination, he slowly started to make a recovery.
Sean and his family have always been extremely positive throughout this horrendous ordeal, and I'm no doubt that if you can get that focus with any young person going through rehabilitation, that definitely helps them achieve.
Had fed up.
6 months on, Sean's still working hard to get better, and his family can now reflect on their gruelling experience.
I can't really describe it. It's every parent's nightmare, you know.
It just seemed as if it'd never end.
Sean's put his heart and soul into every aspect of his recovery and has even taken his first small steps.
Perfect.
Failure wasn't an option. I wasn't going to give up. So even though the people around me were saying we don't know if he was going to walk again, but I still had it in my mind. I know if I try hard enough, I'll be able to do it.
Sean has been an inspiration because he is so positive in the way he approaches his therapy. He just wants more and more and more. I mean, you could spend the whole day treating Sean, you know, because that's what he wants.
I'm feeling really positive now because I'm so close to going home.
I thought, because of how seriously ill he was, that it'd take a lot longer than this. He's amazing, he really is.
But before Sean can go home for good, he has to demonstrate to occupational therapist Liz Gear how well he can do some of the things most of us take for granted, like making breakfast.
What's on the menu this morning, Sean?
Actually, there is no menu.
All right.
Because it's just me, Alvin. No, this bit I've never been able to do. I got it that time.
Well done. Well done.
Do I have to do the washing up or can I give that one a miss?
We might let you off today.
Sean will be discharged from the hospital for good in 2 weeks' time, but later today he's going home for the weekend and has a very special goal in mind.
It's really important for me to walk out of the hospital because I got rolled in the ambulance. And I'm walking out with my head high so I can be proud of how I've done.
In a few hours' time, Sean will attempt the next step of his remarkable recovery. It's been 2 days since 8-year-old Caden had an operation to correct a shunt in his head, and things are looking up. His headaches have now stopped, but to be absolutely sure the surgery's been a success, neurosurgeon Chris Parks has taken a fresh scan of Caden's brain.
So you can see the fluid spaces called ventricles inside his brain, which are much more dilated, much bigger on the pre-op scan than now, where they're collapsed right down, which gives us a good indication that the shunt's working well. That's obviously what we want to see.
I'm not a doctor, but as soon as I walked in the room and seen the scans, like both together, you could really see a big difference. You don't want that.
It's a great result and one that means Caden can go home.
Just can't wait to get home now. Caden's happy. We're happy.
Oh, aye. We're over the moon, aren't we?
Yes.
Yes. Caden will continue to come to the hospital as an outpatient, but for now, he thinks the news is absolutely magic.
Now you see it. No, you don't. I'm really happy because I'm going home. I'm excited going back to school and going to my nana's because I can play with my mates.
Say bye. Hi, Caden. Bye.
Seeing him leave is what, no offence to Caden, but getting people out of here is what the whole point is.
Finally free to go home, Caden's got a smile on his face and can get up to his old tricks again. It's a very special day for Sean Malone and his family. He'll be leaving hospital for good in 2 weeks' time, but right now he's going home for the weekend. And Sean being Sean, he wants to do it in style.
It's been his goal to walk out of the hospital because he's been stretchered, wheelchaired, he's been in and out of scanners, he's been hoisted. He's going to go for it, isn't he?
He is,
yep.
Definitely.
So after these 6 months now, this is my moment. I'm gonna walk out the doors, just walk to the automatic and see them slide open like it's stars in their eyes. Tonight, Matthew, I'm going to be... Who am I going to be, Mum?
You should be Sean Malone, because I wouldn't want you any other way. A walking Sean Malone.
For the past 6 months, Sean's been on an incredible journey, and now he wants to prove to everybody just how far he's come.
I've got this.
You've got this?
Nearly done it, huh? There's my doors.
One son, yeah? Go on. Yeah, you walked outside them doors.
You did it.
Thumbs up, son.
Dad.
You've done it, mate.
Good lad.
Sean still has months of therapy ahead of him, and he will need further surgery, but his sheer determination, together with the love of his family, should help him make the best possible recovery.
That felt well good.
Amazing, aren't you?
I feel like a weight's been lifted off my shoulders now. I know I can do it.